Hey everybody, this is Dr. Farouk Javed, your president for FACD, Florida Academy of Cosmetic Dentistry, the year 2021. And I want to welcome you to another episode of Latte Talk with Dr. Javed. And this is mostly dental. However, it's great for general public as well. I have really the honor of introducing Dr. Okuda from Hawaii, and hence the music. And this is as authentic, as cool, and as wise and experienced as they come. So especially for the younger dentists, Dr. Okuda, I know he's taken it a responsibility to teach the younger generation. I want to thank Dr. Okuda for giving me his time. This is great, and I'll be posting this on our Facebook page as well. So please enjoy. If you have any questions, I'm gonna put all the relative links above, and have yourselves a great day. Thank you so much, and thank you, Wynn, again for your time.
Hey.
Hey, doctor, how are you?
Good.
Nice to see you. How's everything?
Good. How's yourself?
I'm good. I have a special background.
I love
for all my guests out of town, I have their special background.
Oh, well, you got a good one right there.
I'm telling you, I've never been there. Can you believe it?
Well, you got a friend here, so you got
I got a good excuse to come over there.
You got to come here now. Yeah, I'll tell you, people are coming in, and it's like a, how should I say? It's like a discount to come to Hawaii now, but the problems we're having is just that all of this testing, it's like some people are denied certain testing because I don't know, they don't have it standardized, right? The testing.
Yeah.
So that's the problem. But once they get through those bumps and bruises, I'm telling you, man, it's cheap to come to Hawaii right now. Probably the cheap.
You know what?
It's the 70s,
I should talk to the family about that. We've never been there, and I've had friends that are there, and I've had, you got
to come over. You got to come. Now you know a guy here locally that,
I'm telling you, this is great.
I got all the local spots. You're not going to have to go. I mean, you got to go some of the tourists, right? It's things, but then like say places to eat and all of that, it's better to kind of go around with a kama'aina. We call ourselves kama'aina, which is locals here. So, yeah.
That's great. That's great. So just to introduce you, this is as you know, I'm going to put this on my channel, my YouTube channel, and also I would like to. I'm the president of the FACD, Florida Academy of Cosmetic Dentistry this year.
Congratulations!
Thank you so much. I appreciate it. It's such a privilege. But I want to put this on our Facebook page as well, the FACD Facebook page,
which
we have a lot of followers, and we have I want the membership to see this, and I especially want the younger dentists to see this. Just to begin with, we've known each other. I've taken your class at AACD. I took one in San Diego. Tell me a little bit about yourself, so my audience kind of knows who you are before we get into some questions, because I find you so awesome. Seriously,
you're too kind.
I'm
just a local boy from Hawaii. In the end of the day, I'm a local boy from Hawaii. And I think, first of all, are we starting already? Is this it? This is a start point?
We've been recording. This is it.
Okay. So this is kind of like this is the beginning. I didn't even know. I thought we were doing it impromptu. Okay, what are we going to talk about? But then
hold on a second. And go. We've been on for a while.
You see, and this is what I love about you. I love about the fact that you're so fun-loving. You when you post stuff, it makes me smile. I'll tell you, it makes me laugh. I love the last one you put on about the what was that about the lottery? That was hilarious. So, that your wife is not allowed to go to the lottery because she already hit the jackpot.
That's right. There's a law. If you hit the jackpot, you cannot play the lotto. And she had the jackpot by marrying me.
She got you. That's the biggest jackpot. It's the gift. It's the gift that keeps on giving. That's what it is.
I showed her the post. She's not on Facebook too much. I showed her that post. She goes, "Oh God, again."
That's the great thing I love about your fun-loving spirit. It makes me, because it's a breath of fresh air to all of this stuff that's going on, right? Yeah. And of course, now it's all just as it gets to this whole election thing. It's just all muck.
I
So,
know.
so it's great to just talk about, life and
Just
how do we get to where we were getting to, right? I mean, did we really have an idea? Yeah, I kind of did, but you have to kind of have that drive, and we'll
yeah.
talk about that as to because I'm a pretty driven person, even though I'm from Hawaii. I'm kind of like, my dad called me a what does he call it? He called me a banana.
Mm.
You know what he called me? He said one day, he said to me, Wynn, you're a banana. And I said, what's that? He goes, you're yellow on the outside and white on the inside.
What does that
So I'm
mean?
like,
What does that
get
mean?
it? It's like I'm Caucasian. I'm like a
Oh,
mainlander
oh, I
on
got you.
the
I got you.
inside.
I got you.
I'm a
Okay.
mainlander on the inside, even though I'm yellow skin, right?
I got
Asian.
you.
So he called me that. I was like, oh, what is that? Banana. Like, I'm free. I'm good. I'm tropical. No.
You
He
know
was
what? I gotta tell you this.
yeah.
I honestly, you are so approachable, and that's what I love about you, and that's what I love your passion about what you do. You can tell, and you know what? And not to put anybody down, and not to. There are people in our industry. We have such exciting stuff to present to our peers, and some people have the most boring way of presenting it, but you have such a fun loving, like I said, approachable and awesome attitude about you, and that's what I love. And you care about your colleagues, and you care about the students and the young dentists, and I really want to get into that. And I know I
Yeah.
said 35 minutes, but we can
No. I
we'll
listen.
probably
I've
go.
got time here, so whatever we're gonna talk about, let's. I have no clock. Okay, so
Okay.
it's just whatever. It's just we're shooting from the hip. This is all impromptu. I didn't even know when we were starting, so
That's a good thing.
yeah.
um, so let's really get into it. So tell me a
Okay.
little bit about your education, because you're up there. I mean, honestly, I know you told me a story one time when you became accredited to AACD, and you said, "What else can I do?" And then
Mm.
you became a fellow. But I want to hear it from you. What is it that drives you, and why? I
Okay.
really sometimes, when I interview people, I really want to know the why, because
Yeah.
people do things.
Yeah.
I
I,
want to
I'll
know
I'll
why,
tell
so
you.
I can.
I will tell you the answer to that. And, part of it is my upbringing, and a big part because, I'm second generation here in Hawaii. So meaning that my parents are from Japan. So we're on separate coasts. And so you come from a different land, right? Your
Right.
upbringing. I come from a different upbringing. Mine's is Japanese. So I'm fully Japanese, but I'm Japanese American. And so, it's the notion of coming to America and being able to be dutiful to my family, to be us, to try my best to not please my father, but was to make a name,
Yeah.
and to create the foundation for the Okuda last name, the Okuda name. And I remember as a youngster, we had white pages, if you recall. Remember yellow pages and white pages, a
Yeah.
phone book, right? And here in Hawaii, there's a lot of last names that are common, like Nakamura and Tanaka, those types of last names. They'd have 3 pages of these, but in my last name Okuda, we had like half a column. And so so I remember thinking about that. Wow, there's not a whole lot of Okudas out there, and so I thought I really need to make a mark, to bring honor to my last name. So that kind of was a start. So I just being honest with you, I just want to let you know and that was probably when I was probably about 7th grade, somewhere around there. When I remember looking at the yellow pages. So it was kind of that passion to be successful. And then the question was, well, and of course that was just part of the making of who you are, the foundation. But then beyond that, I did, then I wasn't thinking, well, it's going to be something, what am I going to be successful at? It wasn't that. It was just organically, I grew up. And here's the interesting thing that a lot of people don't know about me. I grew up hating dentistry. Isn't that
Really?
interesting? Oh yeah. I grew up, and you got to understand, Hawaii back in the 60s and 70s, it was brutal. Dentistry here was brutal. They didn't even give anesthetic. So,
Oh my God.
that was kind of the my beginnings. And so and this is important to understand this part in order to understand the stories that come
Sure.
along with like the whys you're talking about.
Mm.
So that's why I'm kind of delving into this. And, I shared this story because it's really a personal story of how much I hated dentistry because I was so fearful of dentistry. And a big part of that was because my dentist, who I don't want to name because it is what it is, right? But just in general, they didn't give anesthetic back then. They weren't really looking at people for the sake. They were looking at teeth. They weren't really looking at people, and so they would drill on my teeth for a couple of hours. With I don't know if you ever recall the belt-driven handpieces. Those things. For your young dentists, it'll probably be in a museum. You'll see it one day. But the thing is that. That's what I was drilled on, and it was painful for several hours.
Yeah.
Okay. And with no anesthetic. And so, and oh, by the way, on top of that, I live right next door to the dentist. So, so every morning I would wake up and I would look out my window and I would see his office.
Oh my gosh.
And so my mom only had to drag me through a hedge and up 5 steps and into his chair. So there was nothing, nothing for me to hold the door of a car or whatever, right? To pry me loose or something. But that's my humble beginning with dentistry. And so I grew up hating dentistry. And then there came a point in my life, and this is where, somewhere around 9th grade, I remember telling myself, there's got to be a better way to treat people.
Yes.
Not teeth. There's got to be a better way to treat people. And so that was my thought. And so that's why, so in dentistry, right? And so this is where it all started. It all started with me having this really, this epiphany of helping to make experiences better. It wasn't about teeth. And so then from that point, it started sinking in about dentistry. And then I decided to kind of overcome my fear and volunteer for a local clinic, dental clinic. It was called St. Francis Dental Clinic. It was part of a hospital. But then I was volunteering there. I would volunteer during the summers. And so, fast forward, I would volunteer for 7 summers. Remember, volunteered for 7 summers through the volunteer program. And I really needed to find out, is this really the avenue? Is this the thing that is going to make me happy in doing and trying to overcome this? And, the reason why I bring up this, because, there are people who go into professions because, like, say some people will go into the medical profession because their grandmother or someone close to them died of cancer. So they'll go into medicine to be able to their idea is to get a cure, to discover a cure, right? Because you're trying to heal your own past, you're healing your own self. And that's kind of what I was. This is where I was at, I was trying to heal myself. And I didn't even know that, but was what I was doing, and trying to overcome this fear to be able to then hopefully help others so that I could help myself feel better about dentistry. And then, now fast forward, that's when I went through, University of Hawaii pre-dental program. And believe me, I'm not the sharpest knife in the drawer. Okay. So, but I was very good. And I was really passionate about governance. So I was like pre-dental society president for, I think it was 2 terms there. It was my sophomore and junior year. And then I got accepted early admissions to Oregon Health Sciences University, which was probably not the smartest thing I did. Okay. But, being a young person is like, oh, I'm getting accepted early admissions, then you go there and then you realize that, oh my God, how much I don't know, I should have stayed that 1 extra year in college. And so I really had to fight through dental school because my classmates were like on their second careers. They were like science teachers. They were like biology and chemistry teachers that taught at high school. And now they are my classmates and they were setting the curve. How horrible was that, right? So it's like they didn't have to even study, right? They didn't even have to study. They already knew all this information. Right. And I was like this, the youngest guy there. And so I was always the person fighting the uphill battle. And then, eventually I got my feet under me, and then I was able, I became junior class president. And then, so I was always in governance. That was really, that kind of, that was appealing to me. It was appealing to me to be in governance because it was to, organization, volunteer organization, all of that. So then even after I graduated from school, then one of the first things was I was looking for, where's the Hawaii, Academy of General Dentistry, things like that. the AGD Hawaii constituency.
Mm-hmm.
So I joined that. I joined, of course, the Hawaii Dental Association. But young guys like myself, we started with the AGD mainly, and to try to really do things with that program. So eventually, I became president for 2 terms. And that was only, and it was small, and so it was a small constituency. So, so I was able to then fast track myself there. Then from there, then I got involved with the Hawaii Dental Association. And so all along, I'm always kind of pushing myself.
Yeah.
So that was my beginnings. I was pushing myself to that next level. And it wasn't in lecturing or teaching. Okay, I started off being an editor. Started off creating the Hawaii Academy of General Dentistry newsletter. And so I was writing for that and won some editorial awards through AGD and what they call the Golden Pen. It was through the, what's that? I think it was not the International College of Dentists, but American College of Dentists. They had like a thing where, you would enter, your writings. And I was always weak at writing, but now, always strengthening my weakness. And that has always been a pursuit of mine, again, because it always goes back to trying to be a success for my name, my last name. Mm. And so you see what I mean? Sorry, I don't mean to bore you with this, but
this is so interesting. I've got to tell you this because this is so interesting for individuals that are watching this. The membership, new dentists. I find such a commonality between the people that I interview, successful people that I interview, and I've interviewed Kyle Stanley, Simon Shard, Dr. Miguel Stanley.
Right.
The commonality.
Great world-renowned people.
Yes, and they're all driven, and they're all pushing themselves, and they're all just pushing, looking for that next thing, and I find that common within like yourself. So no, you're not boring me. This is so interesting because this is such a great tool for somebody who's coming into dentistry. And just to go back, this is I'm going off everywhere now.
No, go ahead.
You said about being apprehensive and going to the dentist and no anesthetic. I have patients today that think like that. And they think this is what's happening now, not knowing what's going on. Honest to God, you posted that picture of a massage chair in your office.
Yes.
How far have we come? I mean, how great is it right now? I honestly, I think to myself, how lucky I am to be doing this. I'm doing all this digital stuff and I'm doing all this implant stuff. How lucky are we to be doing dentistry at this era? And I know, and so blessed. Gratitude to me, it's one of the biggest things in life. And I'm always grateful for being able to do the type of dentistry that we do. Mm-hmm. So I want to get into what you do, and I want to get into the AECD a little bit, and I know your drive pushed you to be better and better and challenge yourself to become a fellow in AECD, and that's not an easy task. It
was harder than I thought, okay, I'll go and get my fellowship. I said that, and then I was telling my practice manager back then, wow, it's actually harder than I thought.
It's not just taking some raw photos. That's not it.
And because the stakes are high, right? Because if you fail a couple of them, it's not like failing one or two. It's like you fail a couple, that's it, you're done. And it's like, that's 5 years down the drain kind of thing, right?
Yeah. You know what? I like to just quickly get into that, just a little bit of the AECD. I want to give some time for AECD because we're coming up and going to Denver, hopefully this year, which it looks like it's going to go on. But tell me a little bit about the accreditation and the fellowship.
Well, okay, so I went and, after my journey through, so this is kind of a continuation. After I was with the Hawaii Academy of General Dentistry, I decided, and I was really fortunate. I really strengthened my weaknesses. This is a really important part. Strengthening your weaknesses, recognizing not just your strengths, but what is your weakness? And for me, writing I was always poor at writing. Because I grew up with something called dyslexia. Mm-hmm. And I grew up with ADHD, so so I'm not afraid to say that because back then there was no such diagnosis
Right.
back in the day. They just thought you're dumb,
Yeah.
pretty much. But they knew I wasn't dumb because I was pretty smart at science and math. I was just said English was a tough subject for
Yeah.
me.
Yeah.
And so that's why strengthening my weaknesses of writing, that's why even to this day, I publish articles. In fact, one is coming out through Dentistry Today next month. But I continue to publish, and I consider to strengthen my weaknesses. And also being a columnist with General Dentistry magazine was, again, always pushing that envelope of challenging myself. And I think that's a real important message that people should really look at, is how do you challenge yourself? And so then now that comes into the, then I found out that, because I'm strong in art, growing up, I didn't really mention that, but I think I was really strong in art. I would, like draw a lot. I would paint. I was painting with acrylics in college and things like that. So, so I took I was really important for me, the art part. And then I made the connection, early 90s with art and science of dentistry, which is now cosmetic dentistry.
Yeah.
So, kind of in that pioneer, I have my own version of how I teach and how I look at cosmetic dentistry, which is more from the artistic side, not from the computation point of view, the objective, the proportionality, only the golden proportion of things. But I look at how does all amalgamate together, and then to be able to assess how I'm going to overcome the challenges for my patients. And then that's when I started and I was able to join the ACD. Now, the ACD I joined, but I couldn't even afford to come to the meeting for the first couple of meetings, okay? Because coming from Hawaii, I was just starting off.
It's hard to travel.
What is that?
I said it's hard to travel all over the place, every year from Hawaii.
Yeah. And, because you got to travel a body of water called the Pacific Ocean to get to land, so that's the first, and then it's expensive, right, to do that. So, and so at first I couldn't even come to the meeting, and I wanted to come to it, but I couldn't come to the first couple of meetings. Finally, in 93 was my first meeting, and then met all these amazing icons in cosmetic dentistry that you would read in Dentistry magazine. And Dentistry Today, you would see, oh my God, there's Ross Nash, there's Larry Rosenthal, there's Jeff Morley, and like, oh my gosh, there's Jeff Shapiro. All of these guys was like amazing to me, who and these end up being my mentors, and who I would kind of follow how they would look at things. And so that's when it was that I knew was going to be my next challenge, because I already knew cosmetic dentistry was the important part of my life because of the artistic side of dentistry. Was really, the artistic side with my right brain thinking was really important to meld it together. So that's why having to then, pursue cosmetic dentistry. So this is where then the accreditation comes in, because the accreditation, I've always been a person that challenges myself. In anything. I'm not like, I guess, I think I'm not ultra competitive. Somebody would say I am, kind of thing, so, you see yourself a certain way. Other people say, nah, you're competitive. They see it, and I'll be like, no, I'm not really. They go, nah, you're competitive. And I think, okay, so I am competitive. So, I challenge myself to then be able to, and, you really got to put yourself, I look at this, I look at it as climbing on a branch of a tree, and it's like, will that branch break, or will you be able to get the fruit at the end of the branch? I always look at life like that. Every time when I'm always at that moment, whether it's being a live interview with the local media, or I always tell myself, I'm putting myself on that branch again.
That's so interesting. I've never heard of that expression or analogy.
But it always goes hand in hand with opportunity meeting preparation.
Yeah.
So I'm always trying to be as prepared as I can, for whatever it is, whether it's a lecture or whether it's a, interview. Of course, this interview is just two friends talking, right? So I didn't have to prepare. I just like, okay, turn on the Zoom, let's go.
Right.
And the most important thing really is, that's what I really define as luck, because people say, oh, you have good luck, and I don't believe in that word luck. I believe you create your own luck. And I've always felt that, I've always thought that, because being a second generation, in America, you have to create that luck. You cannot, things won't just come by you.
That's
things,
great.
And sometimes they will. And if they do, if you're prepared, then you've met that objective, and then you're lucky, right? But other than that, it's always, and I try to teach my kids that, and I teach everyone that, it's like you have to create your own world. And so
Yeah.
that's why keep on focusing, keep on preparing yourself, keep on climbing, what I call climbing the ladder.
Yeah.
Okay.
Yeah.
If I ever write a book, the title book, it will be Climbing the Ladder, because that's how I see life.
I like that. Yeah.
Because, everyone when we all start, we're all climbing the ladder, but there comes a point where people stop climbing the ladder.
Yeah.
And then as long as you keep on climbing the ladder, you'll see other people drop off and drop off. And next thing you know it, you're the only one there.
Yeah.
You see what I mean?
I
That's where success is. And I think that you understand that, because that's where you're at. That's what I feel.
And I realized something, it's such a simple thing. These are, we're like talking. I was talking to my son. He goes, "Daddy, this is hard." I say, "You know what? Being successful is hard. You got to work at it. You got to really, I mean, it's such a simple thing." But I'm putting it in terms of dentistry. I honestly, and I said this before, we are so blessed to have a profession that is continually reinventing. We see
Yes.
new stuff continually. So you can't help but to climb that ladder.
Yeah.
I'm getting into some digital stuff that, honest to God, it's making my life so much easier. It's just so amazing to do this, and it just keeps getting new stuff, new techniques, everything new.
Mm-hmm.
And you can't help but to continue your drive to be better, to do more, and be of better service to your patients. So that my other question, which we kind of you kind of answered, but
Mm-hmm.
my focus this year, it's going to be, of course, on the membership, but I want to focus on new dentists, on new graduates. They
Mm-hmm.
come out so ready to go. They come
Yeah.
out so strong, and they've been hit with COVID and all of that. But I think we'll get through this, and most people are getting through this. We're all protected and whatnot. But for dental students,
Mm-hmm.
and I know you have a great group that you teach. What's your best advice? Because here, they come out and they get hired by corporate, and there goes all the enthusiasm is gone. It's like, and I'm being honest, because
Oh yeah.
it's all
Yeah.
about
I totally
numbers, all
understand what
about
you're saying.
production.
It's
And it
happening here in Hawaii. So same
Yeah,
thing.
and
Yeah.
it's difficult, and it takes time to build a practice like yours, which you have a absolutely beautiful practice, and what you have created. um but what's your advice for the new dentist
Mm. You
and
know what?
newly graduate?
That's it's a great question. It's an important question, because once you graduate, okay, then you're no longer part of the academic world. You are now part of the world, the profession.
Mhm.
And so no matter which avenue you go, whether it's corporate or, private practice, in the end, unless you really are going to be in corporate all the time and shield yourself from the rest of the profession, you're going to need to learn about practice management. You're going to need to learn about business. You're going to need, I think a lot of people will focus in on clinical technique, and that's important, of course, right? Continuing education, clinical technique, but you really have to learn about what I call the three-headed dragon, which is practice management, business development, and clinical all together.
Yeah.
Because, like, for instance, here's a good question. And I know you know the answer to this, but I wonder how many people can answer this. How do you read a financial statement?
Mm.
Do you know how to read a financial statement? Because as soon as you get out of dental school, you're going to need to start learning about how to be able to look at what real business people do,
Yeah. Yeah.
and do you know what a how do you know how to approach your banker? How do you assess if you have the right accountant?
Mm.
Things like that. Those are real questions that people need to be able to understand the answer to.
It-
And it's not just about how do you move the dental gingival complex.
right.
You know, how do you establish biologic width around an implant? I mean, and those of course are parts of it, but that's not going to help you to be able to build a successful practice. You can be the best clinician in the world and also be the worst success in the world
That is
at the same
so.
time. I have seen that happen. That's why.
So
Very
what do you
Go
recommend?
ahead.
How do they find out about the business? What?
I can tell you that, just having to then, again, talk to see, get a mentor, seasoned dentist.
Yeah.
And, that's why I started this whole Pan Pacific Dental Academy.
Which is amazing, and I'm gonna put a link on that on the on.
Thank you. Thank you.
Facebook.
Because we need to help each other,
True.
because this is a really, and the reasons I wrote this article in Dentistry Today several years ago, and it was about the plight of the associateship and what's happening because of this whole corporate movement. Associateships are dying left and right. And guess what? Associateships in America has been the fabric of the dental profession. It's the handoff from the old practitioner to the young practitioner, right? That's always been it. But now, because of the whole corporate takeover, whatever you want to call it, that they are buying out the older practitioner. And so where is this knowledge that this old practitioner has acquired through his lifetime? Where is that being transferred over to the new person? It's not there.
Yeah.
That's going to be the empty shell. The empty hole is right in between here. Those decades of knowledge. That's why, to me, that's why I created the Pan Pack. It's because that it's not just about good and excellent and predictable clinical technique, which I can teach every day. Okay. Right. But to me, it's about how do you become a success in order to then to provide bread for your family, to provide income for your team, to provide not just great dentistry, but also be able to provide a good practice so you can control your stress.
Yeah.
I know you talked about stress and how that is, but stress is because of the lack of understanding of how to be able to control a lot of other aspects in your life other than just clinical dentistry. Wouldn't you agree with that?
That's so true. Me and Kyle talked in length about that. And he has courses on stress and all the depression and all that stuff. He talks about the negative sides of dentistry, which is great because that needs to be talked about. We have to talk about our colleagues really, again, not knowing the financials part of it or what to do, and they're not established, and they're just thrown into this, and it affects people, if the lack of success or seeing other colleagues, their highlights on Instagram, for example, and said, how can I get there? And that could really stress young dentists. And but I have to say, the people that I have, I posted a case on Pan Pacific, and the people that were engaged, they were so intelligent. These young individuals, they are so good. I wish I was like that when I was their age. But
that's why they want to be experts. They want to get to that point. But that's the hard part. That's the pressure that they're facing. They want to be the expert. They want to be the expert now.
Yeah.
But you know what it takes to be an expert. It takes many years.
It takes time
of amalgamating, of toiling, of thinking through things. I mean, I didn't get to where I got to without having to go through that. I mean, I've been in practice 32 years, and I honestly, I'm still not there, and I don't think, it's, and I just always am, and I get patients coming in here, and they're like, I heard you like a good challenge. And then they take off their mask. Now they go like this. I'm like, oh, like that. And I'm like, and then I try not to say, holy crap, I try not to do that, right? But, but then it's like, there's, and especially after this whole COVID era, there's going to be a lot of dentistry to be done. Because a lot of people are avoiding, and a lot of root decay, all of this stuff, periodontal disease is going to start to get ramifications.
Stress of COVID. I'm seeing things that I haven't seen before. Right. And it's funny you should say that, because I was talking to a colleague of mine, and she was saying, okay, this is my first time doing a wax up and doing 4 anteriors, and one of the most driven, amazing people, and she got so stressed because one side is off. I said, did you have a hard time doing the temporary? She goes, I did. I had to redo it. I said, good. this is how you learn.
Yeah.
This is how I learned. This
Yeah.
is how people that are up there and they're doing this and they're showing their best work. You have to go through these.
Yes.
Don't consider it a failure. This is just a
Part
process.
of
You
learning.
have to go through
It's
the
part of learning.
process
Yeah.
of learning,
Exactly. Yeah.
of doing that. And I'm so proud of her. And she's so driven and she's so
Mhm.
amazing. And anyway, she knows if she watches this, she knows who I'm talking about. But but I want to get to if we can,
Yeah.
uh, if you have a favorite case. For example, you know what? Honestly, one of my the most the best thing that I learn from
Yeah.
other mentors, it's are these one little things, one little pearls, or somebody told me something, to do it one way, and it stays with me for such a long time, and I'm like, why didn't I think of this? It
Yeah. Right.
makes things so easy. And I don't know if you have a case you want to show. So we're gonna go into.
Well, I mean, I just because I just saw this woman yesterday, and I was so delighted to see the results of this one thing I did, which was, she came in with a real challenging high gummy smile.
Mm,
And but the thing is that it's not for the meek. Okay, this is really more advanced versions, but it's just to, if anything, it's and I can tell, there's some things within it that are pearls, so we can talk about that. But I think one of the most important things is to understand that when you learn and you work with your hands and you keep getting better, you'll be able to get to these forms of cosmetic dentistry that you always wanted to be able to,
yeah.
you want to, you ultimately, and this is where I wanted to get to a point where people will walk in, I can look at it and say, you know what, I've done this one before.
Yep.
Right. You know what I'm talking about,
I do.
right? Is
I
that
do.
there are similar cases that'll walk through your door at
Mhm.
different times of your career, and
Yeah.
you're like, oh, I did this, I know how to unwind that one,
Yeah.
right? And
Yeah.
at first it's like, but then a person who's never done it, they're like, holy moly, how do you do that case?
Yeah.
But
Yeah.
it's just that that is where the word expertise comes from. That's that when you get to that point where you have, you know done it, and you able to predictably know that that case will end up the way you want it to end up. See, that's the hard part that I want to teach to, the younger dentists, is that it's not, don't get frustrated because you're not an expert yet.
Yeah.
Believe me, I'm not an expert yet, and I just keep on trying my best every
And,
day.
and
So
sometimes it takes several cases. I mean, you're not going to kill the person. It may not come out as perfect as you might think. It's okay. That's part of
yeah,
the process. But
yeah.
I love that. Are you sharing the case or
Yeah, I can share the case. So I can share with you my how would you want me to do this?
you
So
can
let me
share a
see. I
screen?
go to the
This will
bottom,
be
share
the, I
screen.
just want to say, in the
Okay.
history of Latte Talk, which I don't have a latte right now, in the history of Latte
Which
Talk
is
with Dr. J, we um, it'll be the first time you're sharing a screen for a case. Dr. Stanley shared a screen for showing his clinic. This is the first time for a case. I love it.
okay. All right. All right. So now this, like I said, this is going to be something you got to think through. So, okay, this is where, a case where you really think through what's the possibilities. This is why I always think about the art and science of cosmetic dentistry, which is the right brain creative thinking. It's
Yes.
because when you get to that level, you start to understand the objective science, the evidence-based stuff that we've come to learn. It's really about applying that not within the box, but outside the box.
Mhm.
So I kind of want to start off that case here. So let me go ahead and share. I think this is it. No, this is it right here. Okay. Can you see this here?
I can.
Okay. Can you see right
Oh
there?
my gosh. That's awesome.
So it's Latte Talk. You see, I even put a title to it. You see,
I love
I'm a lecturer. I'm not
that.
going
What
to
a
not
great
put a
surprise.
title to it. Do you see the case of the smile right here? And it says Make a Wish Hawaii.
I do.
Okay. So this here now, this is a really good. I mean, I just saw this woman, and um, the interesting thing about this is that I donated the smile makeover to Make a Wish Hawaii.
Oh, that's awesome.
So this was, and this is really important because of twofold. Number one, it really kind of warms your heart when you're contributing to society. And so this was with their auction. So their auction was, they had a virtual auction, and of course, we want to help the kids be able to have their wishes granted and all of that. So, I talked with one of my friend who's a president of Make-A-Wish Hawaii, and she's a former Miss Hawaii that who's been a patient of mine for a long time, and she's now the president of Make-A-Wish Hawaii. So I said, listen, I'd like to help. Can I donate a smile makeover? And I normally don't do that because it's hard, because you're not, they're going to be putting in money. You don't know there's a lot of obstacles when you're donating something like a smile makeover, right?
Yeah.
So initially this was tagged at something like about 25,000, something like that. And so and it's amazing how people actually bid on this. Okay. So I didn't know who was going to bid on it. It turned out to be a bidding war. It got up to 15,000. And so $15,000 went to Make-A-Wish Hawaii. So it was the largest single donation at that virtual auction. So I felt real good because, like the Four Seasons donation and all of that, not that I'm trying to be competitive, because I'm really not. But that's just a joke. It's another story. But, then here she walks into your door. Okay. And look at what she has. This is a challenging case because, this really is, let's see if I can you see the next tile? Did it come up?
No.
Okay. Let me go. Let's do a manual thing here.
There it is. Can you see that now? I can see that.
Yeah. So this here is a combination of, to me, when I assessed it, it was an altered passive eruption plus an overgrowth of the premaxilla. Okay. That's why her teeth, the maxillary, it's forward. So, that's that. And then, but there was still a lot of enamel underneath there, a lot of long roots, very good keratinized tissue. And so I knew that I could do this. And, she had gone through ortho already. So, and this was a result of ortho. So, so that's why she just didn't want to go through ortho anymore. And she wanted to have bigger teeth. And that's exactly what we do, right?
Can I ask you something?
Go ahead.
I want you talked about altered path of eruption. Can you explain that a little bit because that was a hard concept for me to understand in the beginning. So how I explain it to patients is that when the teeth erupt, two processes occur. The teeth come into the oral cavity, it drops down, and then the second part of it is the gums should hike back up around by the neck of where the enamel is. Right.
That's the two processes that occur. And, that's what Mother Nature does. Now, what can happen is, of course, the teeth can come into the oral cavity, but there's a lot of times it does not go the second part does not happen, where the gums literally will go back, will recede. I don't want to use the word recede, but it goes back up to where it should, to where it's right around by the cervical area of the enamel. That is, and so when it doesn't do that, then that's the definition of altered passive eruption, is that it does not, the second part does not occur.
Right.
Is that what you would agree with?
Yes.
And so, but then also when you look at this case, because the premaxilla is overgrown, that's why it's a combination type situation.
Yeah.
And so she was told at a later time that, that this might be a situation where she would need to break her premaxilla to reset it in order to get her into the normal profile rather than having teeth being forward.
Yes.
Okay. So, she wanted to have a smile makeover. Of course, a challenging case, but again, this is where having knowledge and using the evidence-based knowledge and then the think outside the box, what I just mentioned, becomes important in order to solve this type of case. Okay. So a case like this, first of all, let me say, okay, let me go back here. Let's do this. Okay. Can you see that?
I can.
Okay. So this is her 3/4 view. And the 3/4 view, you can see she has small teeth.
Yeah.
You can see that. And so that's part of the altered passive eruption, but also, again, the premaxilla overgrowth you can actually see from the 3/4 view. So this is a challenging case. Would you not agree?
I agree. Yeah.
Yeah. And also look at the overbite.
Yeah.
Pretty pronounced.
Yeah.
Again, just to me, very, very consistent with that premaxillary overgrowth. So having to then get the correct sizing, again, you know, when I look at a case like this, the one thing I always tell myself is don't eliminate all the gums. And I always try to tell patients that, because that's part of the personality of a person as they're growing up. And so having a somewhat gummy smile, having a really gummy smile is of course not necessarily aesthetic, but it's still part of a person's personality.
It's the character. Yeah, exactly.
Character. It's a characteristic of a personality. So that's why I try to tell patients that, you know, what you want to do is you want to be sure that you have it where the teeth, the exposure of the teeth outweighs the gum exposure. Mm-hmm. Because right now the gum exposure outweighs the teeth exposure. And so that's why this looks unaesthetic. But if we were to reverse it, where we're having more tooth exposure, but yet have still some of that gumminess, right, then to me, that is a good combination from an aesthetic point of view, you know, from a artistic aesthetic point of view, of being able to meet the goal of what we want to try to accomplish, but not overdo it where they stop. And the reason is because of this. And it's a case that I remember reading about back in the early 2000s. It was documented where, you know, back then they were eliminating all the gums. And so they would literally move everything up so that it would fall within 1 to 3 millimeters. Okay. Right. And that was the ideal back in the early 2000s, you know, and as to what is an ideal smile line, right? The gum exposure. The problem with that is what I've always had with that, and I've never really done that because I do cosmetic dentistry, my version of it. I really felt that, again, the issue about the gums being part of the personality is that when you eliminate that amount of gums, where you only have now from this to 1 to 3 millimeters of exposure, the person stops recognizing themselves. You see what I mean?
Yeah.
You can see how that could be a problem, right?
That is true.
Where you can stop recognizing yourself because you look at the person in the mirror and it doesn't look like the person anymore that you know. So that's why, you know, to me, having still some gums showing, maybe it is 3 to 5 millimeters, okay, of gum showing. Maybe it's a little bit more, but then still having the weightedness to be able to be more of the tooth than rather than the gums is, to me, and you know, how I look at the case like this. So it's still reachable without having to do any sort of major jaw surgery.
Right.
So a lot of people, you know, I've really helped, I think, a lot of people having to, that they were told by traditional dentists they'd have to have jaw surgery, some sort of major jaw surgery, whether it's a Laforte one or what not, right? You know, bilateral sagittal split osteotomies or whatever. And I've been able to help a significant number of people avoid that just through this creative process of using, of understanding evidence-based, but then also then looking outside the box to find solutions. Mm-hmm. So that's why I see a lot of patients who come and see me for this. So, you know, the thought is that this looks like almost an I can't do that, but let's see what's possible. Okay. So again, I'm kind of manually doing this.
I understand.
Can you see this here? I know this, we're really, once we stop looking at the actual plane, because this one here has an wait, let me do this. Let me take out this. I got to just take out the animation. I think that's what's the problem here. Okay. Better, right?
There it is. Yes.
See, now I'm marking where I need to lay, what I need to do, how much gum tissue I want to remove. And then what I'm doing is that I'm measuring that up with a radiograph to be sure that I understand what's going on subgingivally.
Yeah, that was my next question. When do you know to do a gingivectomy, and when do you know to
yes. And the answer to that is sounding, is bone sounding, osseous sounding. And so osseous sounding is important in order to understand, you know, because this is where understanding the dental gingival complex, what we know of as biologic width, becomes critical in order to know if this is truly a gingivectomy or is this going to be some sort of an osseous recontouring, you know, type of surgery. So this was a combination of both. A combination. You can see how some of these, can you see my arrow here?
Yeah. Your arrow? No, I cannot.
Okay. So I'm kind of going right over that central incisor number 8, this right central incisor. That's going to, so both central incisors ended up being an osseous. Okay.
Okay. Can
The
you see the
lateral,
arrow?
the right lateral incisor also ended up being an osseous.
Yeah.
How and the you can see this the canine and premolar on the right side ends up. Let me see if I can move this box. Oh, good, I can move the box. Okay, so the anteriors primarily turn out to be osseous, the anterior the incisors, and then the laterals. I'm sorry, then the canine premolars. The premolar on the left side turned out to be an osseous. The canines were more of a gingivectomy.
Now,
So
question. If I'm sorry to interrupt, but how did you
okay.
sound the bone? Just for the doctors to know. How do you
So
sound the bone?
anesthetize. So so you could either anesthetize
Mhm.
or you could use a really good local anesthetic. I mean, I'm sorry, a topical anesthetic.
Okay. Okay.
So I have what I call designer types of topical anesthetics. That's from a pharmaceutical
Pharmacist. Yeah.
company, from a not from a local but from a national company,
Okay.
and so it's like a combination of different anesthetics that's combined in order to create this really strong local anesthetic.
Mhm.
And that's something that, I share with, like, especially with pampakdental.com. So, they can know where to go to get this stuff.
Yeah.
And it's not cheap,
Yeah.
but it's super effective, especially when you're doing these types of procedures.
I
You want
like to know where you get that from.
What's that?
I said I like to know where you get that from.
I'll message you. I'll message you.
Okay.
But it's really good, especially because you can put it right on top of this here, and I will tell you, the patient feels like they feel numb. They feel
Really?
very numb. Oh yeah. So you can sound right there. You
Okay.
can sound to bone.
Okay.
And so I'm going to sound to bone, so it's not just a periodontal pocket reading, but it's sounding to bone. So I know,
Oh, no.
firsthand, where can I do the gingivectomy, which is where do I need to actually do more osseous removal.
Mhm. Mhm.
Okay. And so that's kind of the critical important informations. I always cite this, and John Coyce had a great article in 1996 on on the dental gingival complex, the new concepts of dental gingival complex, and the new version of biologic width in comparison to Gargiulo, the textbook of periodontology. I really cite John's work with being able to do what I do, and he also wrote an article in 2000. It was Perio 2000 on basically on moving the dental gingival complex. And so these are the foundations of how I can do what I do. And it's very predictable. So I like to do everything more minimal invasive, and so that's why closed flaps are the way that which I do a lot of these procedures. I do not do an open flap procedure. I don't send this out to a periodontist because frankly, none of our periodontists has an aesthetic eye here. So, and so I that's why I had to, you gotta learn how to do things because, you learn to do things because there's a lack of something within your community,
Yeah.
right? And you know what I'm talking about. Not that anyone's not talented. I don't want to say that. It's just that they have to be specifically talented to what you're trying to accomplish in order to accomplish it. And I just have never found anyone like that here. So, and so I trust my aesthetic eye. So that's why I had to kind of teach myself. And so I've been doing these closed flap procedures for 20 years, actually, since John came up with those articles, so that was my think outside the box. When I back in the late 90s and the early 2000s, that's when I started doing closed flaps. So it was with much more what I call micro prep burrs until I got to the lasers. And I was really concerned because getting into lasers, it's an all or nothing deal, and you're not feeling the tactile, since there's a loss of, to a certain degree, of tactile sense when you're using lasers. But with a micro prepper, I'm able to feel the topography and the architecture subgingivally.
Okay.
So when people say, "Well, how do you do that?" I mean, because it's really scary, It's and I said, "Listen, you know how to do endo, right?" And they say, "Well, yeah." And I said, "Well, you're going down to like 21 millimeters." A
You're
lot
not
of
seeing
times,
it.
like 21 millimeters. I'm just telling you to go down 3 millimeters.
Right.
So I try to make it like chewable.
Yeah.
So, but it's just that you got to be able to feel for that. And so there is a certain learning curve or a certain curve.
Sure.
And I try to teach this method so that you're able to then, and like I said, you can do it with micro prep burrs. You don't have to have a laser.
Mhm.
but I do it with lasers now because I find the healing is so much better,
Correct.
and that
You have
it's more
the
targeted. It's more targeted, to the actual osseous crest.
and you have the biolace, is that correct? And then
I do. I have the water lasers, yes, and
water lace. I have the Photona, which they work pretty much. We have our tip.
you just got to have the setting correct. That's all.
Correct. Correct.
You just have to have the setting correct for a close, for a closed flap. The nice thing for me is, for the water lasers, I just dialed in already, so it says closed flap, and I just hit the button, and then select the tip, and then you can actually change the amount of wattage if you want to have more rapid burst. But I generally set it a little bit slower so I can have a better control, so I can feel around there as best as I can. And because once you cut, that's it. It's no turning back, right? So, but the beautiful thing is what's possible, and so that's why. And there's a article that's going to come out next month in Dentistry Today, and actually will showcase, basically in an article, this combination of porcelain veneers and this what I call the Okuda gum lift.
Sorry, one second.
Okay.
I lost the screen for a second. Give me 1 second.
Sure.
I lost your screen somehow. Let me see if I can. There we go. When I get a call, my screen completely goes away. So
got it.
Go ahead, sir. I apologize.
No. So that's so I was saying that just there's an article coming out next month in Dentistry Today, and it's going to talk about this combination. So actually, the article is talking about combination treatment during the pandemic. And I find that, because I've heard dentists say, well, patients are scared to come back, into dental offices. And I'm like, I don't find that to be the problem, because I think our verbal skills at my practice is such that we are trying to be nimble with what's going on. And so, and I think one of the things that I can share, what has been really, to me successful, is when you talk to patients, let's say if they have 7 appointments, then they're going to freak out. That means they have 7 possible exposure potential. But if you combine those 7 appointments into 3 appointments, then that's much more palatable from a patient point of view, saying, well, I only got to come in 3 times. So you're going to be able to compress this number of procedures into this. And the answer is yes. And because, to me, it's a win-win situation, because not only are you getting your patient to say yes to treatment, but you're also reducing the number of exposures to patients for your team.
Correct.
So by doing combination treatment and combining certain things like the minimal invasive gum lift with the porcelain veneers, rather than doing it as 2 separate appointments. And in fact, what I do is the gum lift, the porcelain veneers, and the final impression all at the same time.
No,
and I know that sounds very far-fetched. Okay,
I've heard that done. I've heard that even done with CEREC. They do osseous, take an impression, and do the CEREC and give the crown right that same day. But
yeah, so and it's all because a lot of it is foundational as it comes to what John Coyce talked about.
Yeah,
about how you can predict where your margins will be before the gum tissue heals. So that's how I'm able to take my final impression. You see what I mean? So let's go through this here. But you can see how it's the same day prep, right? Can you see the 3 images there?
So you did the laser.
Yes. So this is the laser was done in, first, and then I did the preps, and then I placed my margin, and then I'm creating my temporary.
Nice. The same day,
exact same day.
Very nice. Okay.
Okay. So let's see now. Let me go forward. Okay. So I'm gonna show you this here. Hang on. I'm gonna make this change. That is 1.5 weeks later.
That's really amazing.
So you can see that and again, the most extensive of the areas where the 2 central incisors were, right?
Yes.
But the thing is that that one's going to require a little bit more healing. But the thing is that after 1.5 weeks, we already know where this tissue is going to heal to, because it's based upon understanding predictably where the tissue is going to heal before it heals. And again, I know that's a think outside the box, but that's why you have to kind of understand the foundational parts of why, and I talk about that, in, lectures that I give and whatnot. So it's much more extensive, but this is just, like I said, I just did this case. I just saw her yesterday. That the lower one, I just took that picture yesterday. Okay.
That's
And
amazing.
so this is what it looks like. Again, you won't see this is actually a video, but you can see how it looks. This is a video. You can see the two central incisors still needing to heal. Okay. And then let me, hang on. I gotta take the animation off here. Hang on.
What a difference.
Okay. Okay, good. Okay, so let me show you here.
Wow.
You see that? The possibilities.
Unbelievable. Again. Unbelievable. So you worked hard on those centrals because we didn't see the laser.
Yeah.
Just tell me a little bit.
So I said you saw where I had the lines, right? The black lines.
Yes, yes.
So I did the gingivectomies first.
So you went and you could see the bone, obviously.
Yes, and then the bone was basically sticking right out there.
Right there, yeah.
Like, now the bone is, I can see the bone because now after I went ahead and did the gingivectomies, and then I do my closed flap osseous recontour.
So you took the laser and you went about 3 millimeters.
I cut it down and then make sure it's 3 millimeters subgingival.
Yeah,
it's so simple.
I marked the tip on my laser, and I don't know if that's marked as well, and it shows 3 millimeters and go.
That's around. What I wish. I wish that these tips had marks, 3 millimeter marks on.
I know. I take a Sharpie and do it.
I listen, Farouk, I'm not smart enough. I didn't put the mark on the tip yet.
The rep.
Starting tomorrow, I'm gonna get my Sharpie, put a mark on the tip.
The rep.
I've been like cutting, get my periodontal probe, cut some more, put my periodontal probe. What I really should have done is what you just
there
said.
Is my pearl.
Mark the thing with the Sharpie. mark the darn tip with the Sharpie. How can I get? Listen, I'm marking the tissue, but I'm not marking the tip. How dumb is that?
That's what the rep told me. I'm like, oh, okay, that makes sense.
So can you see the next one? This is the right side.
I can see her left side.
Okay, let me hang on.
But that's such an incredible, in a sense, I'm not saying gift because of you gave this away, but such an incredible gift as a service to your patients.
You see the right side now?
Yes, I can.
Okay.
And that's a week and a half.
Week and a half.
Crazy.
Look at her lip. She's not, a lot of times you'll see these gummy smiles when people take pictures, and it's like, then the person's not really smiling really big. That's why it doesn't look like, it looks like you eliminated the gummy smile. So you can kind of tell when someone actually didn't eliminate the gummy smile, but look, you can see how the flatness and the animation of her lip, how she's really pulling her lip back in her smile line, how it resembles the before image. So you can see how far up I went.
Yeah, yeah.
And of course, I'm very mindful now. Here's the part we didn't talk about. Very mindful about the crown to root ratio. Very mindful of it. That's important. That's an important ingredient as well.
Sure.
You don't just, if you got short roots, okay, then you can't do this.
You can't,
right?
yeah.
You can't do this procedure.
Great.
So
such an incredible case. Such a huge difference.
There's the front view.
That's amazing.
Can you see the front view? Now, here comes the two, and I like doing things in combination. That's how I think I move myself forward faster, is that number one, I salivate for cases like this, okay? Because it's like, I'm kind of like the old mechanic of when you look at it and you see the broken car, you see, it's like, oh, I can fix that, right? So I'm like, that kind of a mechanic thinking that, I can fix that. But then also, I gave it away.
Yeah.
So now, here's the business side of what is important within what I'm teaching in PanPac Dental, at Pan Pacific Dental Academy, is it's not just about the clinical, but it's also combining it. I gave away, a $20-something thousand case, right?
Yeah.
But guess what? How many people are going to see this?
Yeah.
You think, and how many people within Make-A-Wish Hawaii who are part of Make-A-Wish Hawaii, who's usually the leaders of our community, are going to see this.
Yeah.
Because that's part of my business deal with them is I need for you to be able to show what I did. And so, it's we have model releases signed by the patients. We have agreements so that they will showcase it at the next virtual gala, all of that. So then all eyes are on this case. You see what I mean? All I got to do is perform what I normally do. Do you think that this will surprise people what's possible? Absolutely. Will this take me to the next rung in terms of the, so it does several things in the community. And again, remember, this is important because what I'm teaching is not, I don't want people to think that I'm taking advantage or anything of anything. I hope that's not what's coming out here. What I'm trying to do is trying to solve certain things. Number one is help this person be able to get the smile of her dreams at a reduced price. Mm-hmm. Number two is that $15,000, which she donated for this, goes 100% to Make-A-Wish Hawaii. The only thing I want from a business point of view is to be able to have people who are within our community who support Make-A-Wish Hawaii be able to see the type of work that I do.
Yeah.
And then from there, then you're looked upon from a practicing point of view as a nice guy in the community because you've contributed, but also more importantly, you're targeting to the right people. So again, when I talk about clinical technique, practice management, and business development, this really, and it encapsulates all three. Would you not agree with what I just said?
Absolutely. No service goes unnoticed. First of all, I'm positive you feel so good about this to helping this young lady.
$15,000 of wishes granted.
I know, and this is
disabled children
about it.
Of course I want to donate. I gave money also, but then to me it's like, if someone else is going to donate money for this and it's from for my work, why not, right?
Yeah, what a bounty, seriously, and what a blessing to have.
Thank you for saying that.
Do you have a before and after facial shot?
Yeah, I do actually. Now again, she's part of the military, so I just took this. So here it is. But wait, let me see. I want to be sure I didn't have the So there's no animation here. Now, can you see that?
That's amazing. That's just, it's just a completely different person.
Yeah, right.
I mean, I'm sure she's a beautiful person inside, but
no, she is a super individual.
I can tell.
Mm-hmm.
And this just brings out, it just shines. She just shines on the one on the right.
The most important thing, what we do in cosmetic dentistry, and what I do a lot with patients is create normalcy. Get them to where they can have a normal life.
Yeah.
I think that's one of the biggest things that I can do for people. Mm-hmm. It's not about just the enhance, because I always say, there's two versions of cosmetic dentistry, and there's the enhancement part, which is the part that people want to look younger and have the more dazzling smile, the Kim Kardashian look, the whole thing, right? Mm-hmm. And then there's the part where people just want to have a normal, they're born with certain circumstances or they acquired certain problems through time, and they want to just get back to the normal. And I think that's what she represents.
That's such a good point. I have to share. I had a patient yesterday. He came for a consultation, and he decided to stay as a patient. And staying as a patient, and I sometimes I've been told my interviews turn out to be about me, but my point is, our examination consists of CBCT, digital scanning, comprehensive exam, all studio photos, everything. First of all, he said, I've never had this kind of examination. This is what differentiates you and me, and not that I'm any better than any other dentist, but it's just for any young dentist, if you do things differently and comprehensively, and that's the key to all of this. But my point is, to what you said, it's very interesting. He said, Dr. Gervais, I had an accident. We have to do like probably 14 implants. I mean, it's a complete reconstruction. He said, Dr. Gervais, I have not been able to chew for the past 20 years.
Yeah.
Imagine that. Imagine giving something back that they have not been able to do in 20 years. He said, I have not been able to smile. When I was taking photographs, I couldn't get him to stop me smile. Some people prevent themselves or stop themselves. They have programmed themselves not to smile. And again, I go back to how blessed we are to have this, to change that. It's just, you can't even, we can't imagine it because we're not that person. But to have that kind of dramatic change, what a difference. What a difference. And this case is amazing. I bet you she can't stop smiling.
Yeah, it's changed her life. And you know, and I think, you know, especially because I left some of the gumminess, you know, on her, that she says that people, you know, and this is the biggest compliment that I can get is when people say, I know something's different about you, but I can't really tell.
Yeah. Your hair.
That's the best compliment.
Yeah.
Right? Other than, oh, you got veneers. You know, the second comment is not good. That means like, okay, I did something wrong. I didn't do what I was supposed to do.
No, I understand.
But when I hear from patients saying that, you know, because I always like to ask them, has someone noticed? He said, you know, people look at me and they can't quite tell what it is that's different. Then I said, that's the success.
Yeah.
That's a successful story.
It's subtle, but it's dramatic for them.
Right.
But
right. And the key is having it blend with the proportionality of their features, you know, and, you know, and to be able to have them be able to internally have that sense of oneness with this new look.
Yeah.
I think those are things that are, and like you said, I totally agree with you. We're very blessed to be able to have the opportunity to help change the lives of our patients, you know, and who, you know, I mean, in let's say 20, 25 years ago, we would never really be able to say that so, you know, heartfully, you know what I mean? Back then we were still being mocked upon the, oh, dentists, they're so painful kind of thing, right?
Yeah.
But now look at us. We are now I have patients, or I have people on social media calling me the wizard, you know, so, you know, they said, oh, it's wizard time, you know, things like that, you know, and you know, and that just warms my heart because they look at me in a positive way rather than this man with a drill that's going to go ahead and give them pain, right?
Yeah. Yeah. I mean, I honestly, me and Kyle talked about this. He goes, look at the movies. They always depict dentists as the bad this, and now look at us.
Portrayed, back then.
So the times have really changed. And if I just look at the photo on the right and I cover the left, what a beautiful smile.
And thank you.
Even if I not know what the difference is, again, to some, it's their character and this is what it is. But I'm pretty sure she really wanted to change that, and to have that, that's just incredible.
Well, you know, like I said, I mean, I feel, you know, and that's why, you know, why I do what I'm doing right now, because one of the things we're, you know, is what am I doing now? What am I focusing on? And one of the things I feel, I've been in practice 32 years, and one of the things I've just come to find that it's so important for me to really share my knowledge and share what I know with the next generations of dentists. And I think that's really important. That's why I've developed Pan Pacific Dental Academy. It's because, you know, and I've been giving free webinars, you know, and I hope that people will join me because I think I have a lot to say about, you know, this, you know, about modern dentistry, about how we are able to then take traditional knowledge, but apply it to modern society. Because we cannot just be doing the same thing we've been doing, which is hoping and praying that people are going to accept our treatment plans that take 3 years to accomplish. People are not like that anymore. People are, you know, we live in a society that's instant gratification. People are, you know, if we are doing what we're doing, you know, that's traditional, or let's call it, I don't want to say irrelevant dentistry, but definitely outdated dentistry, let's put that. It's not fitting society, you know, because we have evidence-based, but we need to be able to come up with better solutions that meet timeframes. And this is, I mean, if you look at this, 1.5 weeks later, I think I'm coming up with a solution that is the need of modern society.
Yeah, that is wizard job right there. That's incredible.
Well, coming from you, I appreciate that because you are a great man with great skills, my friend.
I appreciate that. Well, I honestly don't want to take too much of your time. I could talk to you for hours and hours,
Well,
but
did you have any other questions? I'm good. If you have any other questions, just let me know. Otherwise,
um,
it's
I think you answered everything. I was gonna say, what keeps you going? I mean, what's next? Which you just we just talked
yeah,
about.
it's trying to not just press, like one thing is that, like say I just like the last year especially got into lasers. And so I'm always trying to find and reinvent myself,
Yeah,
Brooke. I'm always reinventing myself.
yeah,
Someone told me that, every once in a while you need to reinvent yourself and then try to figure out what is to get to that next level.
yeah,
And that's what kind of keeps me moving forward from a clinician point of view.
yeah,
But from a professional point of view, it's really about sharing what I know
yeah,
and my thoughts of creative dentistry, so that it will help the young generation to be able to create dentistry within the society that we have now, not up in the past. Like we don't want to, again, outdated dentistry. We have a lot of evidence-based stuff, but we need to come up with better solutions.
yeah,
And we have been able to come up, like say, Invisalign instead of braces, right? Traditional braces. That's a great example of, no one wants to be seen with brackets on on their teeth. Having aligners, that's a great solution. That's a great, it's taking, it's putting a modern spin on something. But
yeah,
that's what I'm talking about. We need to come up with restorative methods. Here's a good example of a cosmetic, biologic solution
yeah,
that we're able to then meet the needs of modern society. And those are things I want to share. And that's why, I created panpacdental.com and the Pan Pacific Dental Academy. We try to hold annual meetings here. We couldn't this past
yeah,
year, but last year we have an international meeting, people flying in from different parts of Asia and, of the United States. And so I'm really, and just to try to learn, we've done live event. Last time we did a live event here
mm,
where I was showing how I seated like 8 porcelain veneers with a rapid technique.
mhm,
So things like that. I try to press it so that people are able to learn it, but then um, also through the panpacdental.com is to teach about foundational things. Because these things, what I'm showing is very advanced forms of dentistry
yeah,
that I know you could do, but then our younger dentists, younger, audience here, they need to learn about the foundational. So those are things I'm focusing on now, trying to develop videos and things of that sort so that they can understand how to step one before step two kind of
yeah.
thing.
I have to say that's what I truly love about you, because you are, there is a connection. There are people that teach all over, and they are into themselves, and they have their own groups, and that's been my pet peeves, but that's okay. That people do what they want to do, and there is a disconnect sometimes. It's not, I don't see the authenticity,
Mhm.
and you genuinely want to help people. Like you said, you do they the free webinars and things like that. But I can tell you truly want other people to succeed, without sometimes expectations, and that's what's truly genuine about you, and that's what really
Thank you.
is attractive, and that's why you're successful, and I appreciate that. um I
It's my
cannot.
time to get back to the profession. Let me put it that way.
Yeah, no, I get it.
Yeah.
I really appreciate your time. I think you're amazing, and I will put all the links on the on this link once I edit things, and I can't wait to meet you again in person.
Yeah, I know, right? Hopefully, we'll get a chance to see each other at the
In Denver,
Colorado meeting. Yeah,
in
that would
Colorado,
be great.
yeah. And then
That'd
I
be
want
great.
to officially invite you to FACD if you would like to come and
Oh, would love
summer.
to. Love to. Love to. I mean, you guys have a great group of people there. I mean, you guys are all passionate there, and I love that. When I see what you folks are doing, I
Yeah,
mean, I mean, other constituent academies, in cosmetic dentistry can learn from a lot of what you're doing. And especially with you at the helm now, I mean, I'm sure it's going to be tons of fun there, because
no,
Brooke, that's what you are. You are like the guy that brings the party, So
I have to give credit to my board of directors. They are so amazing, from the lab liaison Justin to to Andrew, to Tom, past president, and
Yes.
Jared, and
Tom's a great guy. A
Tom's
great guy.
awesome. Tom's amazing. He's so inspiring. You know, everyone that I interview, the one, like I said, the one commonality is they have the drive and truly inspiring. I mean, what you do is contagious, and that's what I try to bring to this channel and bring some positivity and
I
good.
know we need all of that, and and I appreciate you, and and I'm so I'm glad that we got a chance to meet,
Yeah,
and be able to get and I can call you part of my ohana.
that's
I don't know if you
awesome.
know
And
that word ohana.
that's
You know,
I'm honored, and I have an excuse to come to Hawaii.
you do now, so you're gonna be will that's that's without saying, man. I'd love to see you here, and I'll take you around. We'll enjoy the whole rock here.
I can't wait. Thank you so much, man. I really, really appreciate it. I know this took some effort to put this together.
No,
And
no, but I put this together last night because I just saw her yesterday, right? And I
yeah,
thought, oh, maybe this would be a nice case to kind of like bring out, because it's like to kind of bring hope to, like, okay, once you learn foundation, this is the kind of stuff you can learn to do,
yeah,
to get to this point. And for these young dentists to have something
great
in front of
message.
them,
Yeah,
something in front of them to aspire to.
that's right.
That's what I was trying to do with this case. So, but like I said, it was my pleasure, because I'm an educator. I love doing this, and I love sharing. And but so one day
And
I get a chance to come over to to FACD. So
and you know what? One last thing I'm going to ask you. I'm trying to get, and this is the biggest challenge is this.
yes,
I'm trying to get, and I have connection to University of Florida dental school. I have this amazing, inspiring young kid. He's a D4, and he's trying to get a couple of his colleagues together. I
yeah,
got, I got okay from Kyle Stanley. I got okay from Miguel Stanley to get together on a Zoom with these students.
yes,
I just don't know how to work the time, and I would love to invite you for you to be on that panel because
of course, yeah, my pleasure.
it's just the timing. I don't know how I'm going to get Portugal, California, and Hawaii and Florida together at the same time. Some of us might have to be at midnight,
Yeah,
but, but
just let me know. Listen, just let me know, man. I'm up at midnight too, So
it's going to be so good. If it's okay with you, I'll go ahead and invite you, and we'll work out the times.
well, anything I can do to help contribute, that's the main thing. And it's just to be able to then help this next generation of dentists, because we need to really, I mean, we have this tall order, because we have this, corporate dentistry. And, again, nothing against anyone who's in a
No,
corporate. It's just that for me, what's important to me is people to become practitioners,
yeah,
and not just a provider,
yeah,
and it's to be a practitioner. And in order to be a practitioner, you really need to learn to get the education, but also apply,
yeah,
your skills to be able to help human beings. And and because you can't just do it, and especially with if you're doing it in compressed periods of time. I mean, yeah, I do combination treatment, but I do it in a very quality way. But it can be also done in a very non-quality way, and that could be very bad for patients. So so anything I can do to help for the
that's
quality of
great.
dentistry.
And I personally don't want people to lose that passion when they graduate because like
Yes.
I've said this before. I irritate my wife. I love Mondays. I love coming to work. It is so much fun. It's so great. I mean, we have our challenges, and
Sure.
I'm sure and it's how we deal with them and in a positive way. And
Right.
it's all a mindset, and it's just being able to pass that on. So I appreciate you, sir. Thank you so much. And
Great to
and I'm hoping to see you soon. I'm gonna render this video. I'm gonna edit the parts that paused out, but
okay.
I'll
And
make sure my twin sister gets on.
yeah, tell her I said hi.
I will. I will.
I love the Red Bull, by the way. That's really, you know,
Oh my God,
that-
these apps my son shows me. It's crazy.
stay
But
safe, be safe, and best wishes to you and your the Florida Academy, and also just they have a fantastic leader there. So,
I appreciate
you know, have a great year with that.
Thank you so much. I'm sure I'll talk to you more on social media and soon. So
Yeah, you know, I love the case. Contribute whatever case you want. That's awesome, man. That was a great case. So I'll look forward to talking to you sometime soon.
sounds good, man. Thank you so much.
Aloha to you.
Aloha. Take care.